between the Medicaid cuts at about 8 million people coming off of Medicaid and the 8 million dropped by the ACA, it is just catastrophic in my book.
Social Security's retirement fund could run out of money in just 8 years. And if that happens, the program would have to cut benefits by about 23%. This is not so good for you and me. So what did the trustees report say, and what should you do to make sure you're prepared for the worst case scenario? Well, that's what we're going to discuss in this episode of Decoding Retirement. We're going to talk to my good friend, Marcia Mantell. She's the president of Mantell Retirement Consulting. Marcia, welcome.
Thank you so much, Bob. I'm thrilled to be here to decode retirement with you.
It's a pleasure to have you here. Let's start with the trustees report and maybe give us an overview of what it said and maybe what it didn't say.
Oh, I think that's a great way to phrase that, Bob. So what I want to first say is I actually was really impressed that the report came out in mid-June. I was thinking it was going to be pushed off with all of the cuts in staff and all of, really the angst in the administration. I was not expecting this report to even come out yet. So kudos to the team who got that out. And what I would say is my initial impression reading through, okay, truthfully, I did not read all 286 pages, but I did read the big summary. It wasn't terrible, and the results were not surprising. I mean, the expected depletion date of the old age and survivors fund stayed at 2033. So that was the same as last year. There was nothing in the economy that would have suggested it would improve. So I was not surprised at that. I was surprised, though, on the Medicare side that the Part A, this is the HI, or the Hospitalization Insurance Trust Fund, that one is projected to be depleted, the reserve account, to be depleted 3 years earlier, also in 2033. So that was a little, both expected and unexpected. Unexpected because it was a big departure from last year's report. But if we think about how fast and how high hospitalization costs rise, we know, largely with health insurance and healthcare and everything in the healthcare sector, it usually is about twice the rate of inflation is what we use as projections. So, things are really moving quickly in the cost side of healthcare. So it was bound to catch up at some point. So those were the big, important changes, I think. So not terrible, but 8 years seems like it's a lot shorter than almost 10 years.
Right. So, my read of the summary, I didn't read the whole thing either, but my read of the summary too is that a couple of things. One is, at least on the OA side, that it does move forward by about 6 months or so. And that's partly due to the Social Security Fairness Act, which now provides benefits to folks who were previously subject to the windfall elimination provision or the government pension offset. There was also notes about why the change had to do something with lower fertility rates and also the worker to retiree ratio as affecting these now shorter than last year's prediction. Any thoughts about
it's always
that?
I always find it interesting. And when you listen to the actuaries talk, I think they're just brilliant, by the way. They're looking for very long-term, meaning like 75-year future projections. Well, we don't know what's going to happen at 4:00 this afternoon, let alone 75 years from now. So it's amazing how they think through these projections. So in this year's report, they did take a new look at, our fertility rates in the United States. We're not producing enough children. Well, maybe you and your wife did, but Dan and I we fell short on that front. We're just not as a nation producing enough new workers to keep the payroll taxes rolling in at the same rates. And what they're saying and what they're thinking is women largely are moving out by as much as maybe 10 years when they'll have children. So instead of having kids, at the 25 or to 30-year marker and in the 30, 35, they're pushing closer to 40. So that moves, future workers out further. So yeah, they stretch the fertility projection. And then that impacts the ratio of workers to retirees. I think we're at about 2.5 workers for every retiree. And they also, they put things in terms of GDP, how much, payroll to GDP and that sort of thing. So it gets pretty technical in their thinking, but the net result, you're right, the Fairness Act moved the depletion date for the OASI fund earlier by 6 months and these other two factors by about another 3. So I'm looking at it really simply. Instead of the end of 2033 depleting the reserve account, it's now the beginning of 2033.
Yeah, it's now the first
So
quarter. Yeah.
it's a problem.
Yeah. So I'm fond of planning for the worst case scenario. The Center for Responsible Federal Budget estimated that the impact of a cut for a couple retiring in the year of insolvency would face a $16,500 reduction in their annual benefits. And assuming, for sake of argument, the average benefit is now $2,000, whatever it will be in 8 years, that's a big cut.
It's a big cut. I'm glad you brought this topic up because separately, I've been running some scenarios also for, an article to write for you, Bob. And I looked at, a single person, but what at the higher end, rather than the averages, I'm looking at if you had a benefit amount at your full retirement age. So it's called the PIA, primary insurance amount. If you're at $3,500 as a single person, you claim at 70, right? That's your biggest number you can get is age 70. That would deliver $52,000 a year in 2030, in my example. Then you get a cut starting in, 2033, 2034. It drops down to $40,000. That's, $12,000 for an individual. And the couples, again, I put scenarios together where one spouse is at $3,500, the other's at $2,500. Well, if they each waited till 70 to claim, that's $89,000 a year. And then it would be cut. So again, you're starting with your maximum amount, right? This is a good thing. But then they take a 23%. It's not even a haircut. A haircut is a little trim. This is a sledgehammer, right? I think that's what Jason Victor would say. $68,000, you drop $20,000. So it's bad enough that your guaranteed benefit from Social Security would be cut. But my bigger issue is where do you get it from? Even if you have a fairly healthy retirement account, do you want to spend an extra $20,000 a year when these are pretty young people? We're not talking about 95-year-olds. Well, them too,
Right.
But in my scenarios, they're younger people. You're going to be way exceeding the sustainable withdrawal rate from your assets. And so I'm really concerned about this dual effect of less Social Security at such a big number and then much higher withdrawal rates.
Yeah. So I ran similar projections, but for a 20-year-old that was now earning $100,000 and projected what the effect would be. And I came up with a net present value loss of, I think it was $800,000 if they retired at age 70, 40 plus years from now. But here's the important thing, right? What's the actionable advice? How did someone plan for this worst case scenario? Do they save more now? Do they cut expenses? A mix of both? Something else?
Well, yes, it's a mix of both. Save more. I believe you can never save enough. So, but I've been like that since I was like 9 years old. So saving more is super important. It gives you lots of flexibility, but not everyone can do that. So then how do you plan? And I think it's planning much earlier, starting retirement income planning by age 50. Getting those 20-year-olds, your scenario with your 20-year-old, like that's your best decade to save for retirement. So saving kids, you really got to own this. But I also feel that we are not being nearly creative enough when we only offer like 2 choices or things like, we're going to have to cut benefits or raise the retirement age. Well, no, we don't. So let's be way more creative. And it's all kinds of proposals have been proposed by both Congress and then others who support Social Security, these bipartisan policy groups and think tanks. And there's all kinds of things like, yes, increase the payroll taxes gradually, but maybe we standardize COLA. I don't know. Let's run some numbers on that. Do we change the PIA formula? We don't have to have only one. Do we have one for either those in physical work who are going to have to retire early and one with white collar jobs? Or do we have one PIA formula for wealthy or high income people and a different one for lower income? We do everything the same. So I look at this very small window of maybe 8 years. I think it's not that long, to really rethink everything and be more
Yeah.
creative and do bits of everything so that nobody is, I'll use the phrase overly taxed, but I don't mean it like an IRS tax. Like no one is shouldering the burden in an unequal or unbearable way. So
Yeah.
let's put on our freaking creative hats, Bob. It's not one or the
Right.
other.
Right. So it isn't one or the other. And it's interesting if you go to the Center for Responsible Federal Budget, they have on their website a tool where you can actually input different things like increasing revenue or decreasing expenses or a mix of both and doing this and that and coming up with your own solution to figure out how to solve the crises. There was we're recording a day after there was a webinar where the chief actuary of the Social Security Administration talked and said that the two straightforward solutions that are needed would be the raise schedule benefits, raise schedule revenue by about 1/3 by 2034, reduce schedule benefits by about 1/4 by 2034, or a combination of both. Both of those seem draconian to me. Raising revenue taxes by 1/3 seems like quite a bit. You'd go from what, 6 and some odd
It's
change to like almost 10%.
absolutely. And I literally wrote down because you'd sent me, maybe we're going to talk about these two options. I just wrote disaster. So draconian, disaster, we're in the same camp. These are not tenable for us regular, normal people. We're contributing to this fund. We deserve a secure retirement. We just don't deserve a super rich retirement unless we've done it on our own. So
Yeah.
we kind of need to get back to the basics and need to be much more creative in our thinking.
All right, Marcia, we have to take a short break. Don't go away. Welcome back to Decoding Retirement. I'm talking to Marcia Mantell. She's the president of Mantell Retirement Consulting. And right before we took a break, I promised that we were going to talk about a recent headline that I came across that read that some Social Security beneficiaries are now going to collect upwards of $5,000 per month. And maybe that was clickbait, Marcia? Maybe?
Well, it came from a really reputable news source, Bob. So I clicked and, I just put my head on my desk. It's like, oh, please. The only 59 people in America who are going to get that kind of money were born in 1955 and they've been working and they just turned 70 at some point this year. They've been earning at the taxable wage base for their entire careers. And so those 59 people get $5,000 a month. And it's just,
Yeah.
it's so deceiving because this topic is so important. If you read that and you're an average wage worker, so you're more on track to get $2,000 or $2,500 a month. And even if you wait until 70, you will never get $5,000 a month. You kind of feel like you're getting screwed, right? So it seems like it's unfair and it feeds this frenzy about, and especially in this particular era with, the various people in Social Security mucking around with it. It's just not a reasonable headline, in my opinion. I'm not the editor, so, I'll note that. But we also have to understand, like this year, 2025's maximum calculated benefit for the person who reaches FRA this year, full retirement age, and they also were a high income earner for their whole careers, they get $4,000 a month. So if you
Yeah.
claim this year, because you're at full retirement age, you're getting $1,000. Like, am I $1,000 less? Am I being cheated? So it just sets up feel good about this benefit, this entitled
Yeah.
earned benefit. So anyway, I was
Yeah.
mad when I saw that headline. So
Yeah,
that's
I
my
do want to make mention though of the notion that for people who do want to maybe increase their benefit and people who might have zeros in their earning history, that maybe they consider continuing working to eliminate some of the zeros so that maybe their PI gets adjusted upwards, perhaps. Fair to say?
yes, I'm in total agreement with you. You have to understand how your calculated benefit will work before you can make that leap from, oh, I'm going to get $5,000. Oh, what do you mean I'm getting 2,500? So it just, we clicked, right? I mean, I guess we got the desired click rate up.
All right. Let's go. You mentioned earlier Medicare. I want to talk for the remaining time about Medicare and some of the changes that people can expect as we approach 2026. My goodness. Yeah. Well,
Yeah.
where to begin?
Where to begin? Well, let's start with this. So I mentioned earlier that the HI trust fund, the hospitalization insurance trust fund, is on a projected path to have the reserve account, the savings account, run dry by 2033. But and so one would conclude that maybe we have to pay more for our hospital stays and skilled nursing stays and hospice. But I also want to say that for most people in Medicare, in Part A, so the government pays the lion's share of the expenses when you're in the hospital or in skilled nursing. We pay a deductible if we don't already have a Medigap policy. So prices will rise, but there's also this really cool thing at CMS, the Centers for Medicare and Medicaid Services, called the Innovation Center. And they continually look for innovative ways to help with both quality of care and pricing. So I would like to think they're going to be really busy for the next 5 to 8 years, trying to look at new ways to sort of skin this cat. How can we give seniors and retirees really good quality care when they need it, but not break the bank? So that's one path. Then there's Part B. That's the they call it SMI trust fund, the supplementary medical insurance. We call it Medicare Part B and Part D. That trust fund is fine because the whole trust fund, the checking account side and the savings account side, because we all fund it along with general revenue from taxes. But our premiums will continue to go up. And this year it's $185 per person per month for Part B when you are enrolled in Part B, or higher, all the way up to a grand total of about $600 per month, a little more than $600 if you make $750,000 or more married filing jointly. So it can get quite pricey. We're sharing. Some of us get a higher subsidy, lower income people, higher income people, lower subsidy. Part B, we can expect those premiums will continue to rise. The cost of care for doctors and outpatient services will continue to rise. I use a 6% increase year over year for Part B premiums to project out. Some years at 6%, sometimes it's less, sometimes it could be more. But for a general, where do you go? I use 6%. Part D is a different animal. Part D helps all of us cover our prescription drugs. And there's some really crazy things going on with Part D. Part D plans are offered by private insurance companies. And most of the Medicare sales happen for people getting into Medicare. A and B happens through the federal government, but your Part D is through often independent agents or brokers who sell insurance. And some of the biggest players in the marketplace are no longer paying the brokers commissions. They've already announced that we're not going to pay you guys to sell these particular Part D plans. The net effect here, we saw it last year coming into 2025 also. What had been in Washington State, a woman sent me her 2 bills. In 2024, she paid $3.30 a month. That's not bad for a Part D plan, right? $3. You got $3.
Yeah. Count me in.
Exact same plan, her exact same drugs, nothing from her perspective changed. Her monthly charge jumped to $35.90 a month. So she's paying $430 for this year versus $39 last year. I expect that same thing to happen because what happens, the brokers no longer have on their platforms the ability to see that the cheapest drug plan option was only 50 cents a month and it covered all her drugs. So we are really being not squeezed as consumers. The prices are being jacked up and we're doing nothing wrong.
Right.
And that for me is the biggest problem going out with the Part D plans as a result of, many factors and that these companies
Right.
are all, on the stock exchange.
Right. Well, we didn't, and it would take too long for this segment to talk about how, in the case of Medicare Advantage plans, brokers are getting compensated at 2 to 3 times more than what they would get compensated to sell a Medigap plan, and thus
Yeah.
part of the reason why 50% plus of Medicare beneficiaries are now on Medicare Advantage plans when they might be better off in a different plan, like a original Medicare with Medigap. But we're going to say that for another day because I want to talk about there's in the one big beautiful bill. There's the possibility that potentially 4 million people who are on ACA plans and maybe another 4 million, so call it 8 million people, will get dropped from Obamacare or the ACA Affordable Care Act if the one big
Yep.
beautiful bill goes through. How should people plan for that?
Oh, this one is between the Medicaid cuts at about 8 million people coming off of Medicaid and the 8 million dropped by the ACA. It is just catastrophic in my book because what is happening is, in the simplest terms I can come up with, all of the burden is being shoved onto the regular hardworking consumer to figure this stuff out. We have, a Congress that can't figure it out, an industry that can't figure it out, but all these rules put around normal, regular people. And so you go figure it out if you can cover yourself and your children on any of these plans. And so what's the big thing, I just call it lots of hoops. You have to prove your insurance that you're in a lower, prove your income rather, that you're in a lower income or whatever your income is going to be for the forward-looking year. Well, how are you supposed to do that? There's no auto re-enrollment. That's one of the proposals. Like when you work for a company, if you forget to do something during your open enrollment window, you're just rolled the next year into the same plan that you had elected this year. That's how the ACA had been working as well, so that people don't fall off insurance inadvertently. The proposal from the House is that, we don't want you to be enrolled. You got to actually jump through more hoops to make sure you're enrolled. And they're shortening the window to get enrolled. So there's just a lot of these, I think, flaming hoops that these bills, these provisions in this proposal are requiring people to jump through. And the net effect is going to be people aren't going to know. There is no way for normal people to know this stuff, Bob.
In the meanwhile, I really appreciate you sharing your knowledge and wisdom with us.
Thank you so much for inviting me on, Bob. It's been a delight.
So that wraps up this episode of Decoding Retirement. We hope we provided you with some actionable advice to help you plan for or live better in retirement. If you've got questions about retirement, email me at yfpodcast@yahooinc.com, and we'll do our best to answer your question in a future episode. And don't forget, you can listen to Decoding Retirement on all your favorite podcast platforms.
This content was not intended to be financial advice and should not be used as a substitute for professional financial services.